Hello, this is Smita Kumar, and you're watching Medicircle. Today, on our cancer awareness series, we have Dr. Karthik KS with us. Dr. Karthik is a renowned surgical oncologist in Mangalore and currently practicing in KMC Hospital, Mangalore. For the past 10 years, he has worked as a cancer surgeon. He's a well known member of the Association of Medical Consultants. Hi, Dr. Karthik. Welcome to Medicircle.
Hello, yeah, thank you, madam. Thanks for that introduction.
So we are very glad because the way cancer is spreading in India, we definitely need to raise more and more awareness regarding this deadly disease so that people actually go for regular checkups because the early the detection and diagnosis, the better and sooner is the care. So Dr. Karthik, let us know what causes cancer.
See, there are several things to simplify what causes cancer is very difficult. To simplify, actually, what happens is in any body is a continuous change, which is a cell is dying, a new cell is taking birth. So there's a balance in the body happening between the cell death and the cell birth. So when there is this imbalance where there is a loss of the cell death, that leads to an indefinitely multiplying cells, which leads to cancer. So what leads to this? What situation leads to this? Is we can broadly easily classify into environmental factor and the host factor. Environmental factor is which is outside, like pollution. Most of the pollution or radiation hazard, radiation from the cosmic waves, which cannot be controlled. Some radiation is there in the inbuilt soil. So these are all the environmental factors which as an individual we may not be able to control. Then there are these host factors. Host factor is where immunity works. So there is a balance between this environmental factor and host factor. So any ill effects in the body will be countered with the host immunity. So when this imbalance again strikes, that leads to the imbalance which I already told. So what actually happens is, for example, people keep telling that like my grandfather smoked BDs or cigarette till 90 years, but nothing happened. But another person is having cancer in just 4 or 5 years of using tobacco. So this is where this key things play the match between the environmental factor and the host factor. If the environmental factor is very mild, it may not affect if the host immunity is very good. And if the host immunity is very bad and the environmental stress of any incident is very high, that leads to cancer. So that's how the cancer is caused.
Okay. And as the number of cancer cases in India is rising at an alarming rate, like the average annual rate of cancer cases is between 1.12% from 2010 to 2019, and that's according to a new report. So that means the cases are increasing in different domains, especially the three important cancers that kill the most people in 2020 were lung cancer, colorectal cancer, and liver cancer. So tell us, doctor, there is one myth or there is one conception always around people that it cannot be completely cured or completely treated. So how true is it?
So when you use that, it cannot be completely cured or completely treated. See, basically, we don't use a word cure in cancer. That may not translate always. So what we use the word is the overall survival. So there is nothing called cure in a cancer. Why I tell you? So we speak in terms of overall survival. So in a case, like I'll give you a simple example, in a CA breast, in a carcinoma breast, when we detect a patient in stage 1 or 2, the overall survival, 5 years overall survival, or even 10 years overall survival can be up to 90 to 95%. So that 90 to 95%, you can call it a cure. Okay. So in a thyroid malignancy, papillary carcinoma thyroid, the 20-year survival is up to 90-95%. So again, so that is where we call as a what we call as a survival rate rather than the cure. So what happens is, if you see, cancer is largely a geriatric disease. It's not usually seen in a younger population. So our patients are usually of 50 plus or 60 plus. So tell me a patient with 60 plus and we are able to diagnose the patient early and we are able to give 10 or 15 years of life. That's almost living like a normal survival of a normal human being. That's why. So like you can't call it as it cannot be cured or treated. So when we diagnose early, we are able to give very high survival rates.
And as cancer is mostly sometimes called as its genetics, that it's a genetic disease and it is caused by certain changes to genes that are carried over generations and over generations. So, like, is cancer really genetic? And if my godparents or their my grandparents were having cancer, how likely is I to develop cancer?
So we have to understand two or three words here. One is genetic, another is familial. Okay. So what happens is in this familial is what you are telling. When the gene is transferred from generation to generation, there are few genetic diseases or the genetic carriers like HNPCC disease or BRCA in breast and ovarian cancer. So these are the things which run in families. So such cancers which are low as 3 to 5%. So that is the familial cancers which we are speaking. When we use the word genetic, yeah, familial cancers are genetic cancers which are transferred from one generation to another. But having said that, see, what happens in genetic mutation? See, I already told you the environmental factor, host factor, the imbalance between the death and the birth in the cell lines. So what happens? This imbalance is ultimately because of the genetic insult. Okay. So not all of these genetic insults are carried over from one generation to the another generation. It is only 3 to 5% of the whole cancer are responsible in these kind of situations. Why I stress on this is because I get so many patients who come and say that my daughter is not able to get married because I had cancer. So it's not like that. And whenever these familial cancers are there, it's very obvious. A similar kind of cancers having been seen in several generations, at least 2 or 3 prior generations. So this is about the genetic and the familial cancers.
How curable it is, like, because it totally depends on the type and the stage when the cancer has been detected. So as you have been treating patients for over a decade, so let our audience know what is the change in the treatment patterns. It is how developed is science now to cure cancer, also how patients are getting more and more aware about, and they are approaching you in very early stages so that the treatment can be done, and it can be cured to a larger extent.
Yeah, so thanks to you people who make this awareness happen. That is first thing, and that is very important because there's a lot of nihilism behind this cancer. The moment there's a word cancer used, that's many people think it's the end of life, but it's not like that. Actually, it's like our aim should be to detect and then diagnose case at as early as stage 1 or 2. So what is happening in India is because of lack of awareness we are seeing more and more patients in stage 3 and 4, and over the time we want this to shift from stage 3 and 4 to 1 and 2, so where we are able to save more and more patients. So I'm a surgical oncologist mainly dealing with the solid tumors are those tumors which we are able to operate and remove. Then there are these liquid tumors like blood cancers and related, where largely the treatment is chemotherapy based. Our surgical oncology role is mainly for biopsies and diagnosis. So it is largely treated with chemotherapy. There's a very good progress in that line, and we have diseases which are curable in up to 85% of the times when it comes to lymphomas and leukemias, the blood related cancers. Then coming to the solid tumors, which we have operated. Generally solid tumors are operated and removed, but also the timing is important. So when we are supposed to operate, is it directly we have to operate, or we have to give some chemotherapy or radiation therapy and then treat? So for example, in case of rectum, when we treat the patient with neoadjuvant radiation, the chances of local recurrence are very low, to the extent that when the radiation is not given, the local recurrence chances can be as high as 30 to 40%. And when the radiation is given, the local recurrence chances are as less as 10%. So this makes a huge difference for a given patient. So the timing is very important to like judge when we have to treat and when we have to operate, when chemo and when radiation. And coming to the recent advances, largely we have much and much minimal invasive like laparoscopy or robotic, but that may not matter much. So people need not go into hunting these fancy things. Yeah, definitely they are good, but when in India we have to speak about even the lesser served areas where people need not this thing. What is essentially is to get it treated according to the oncological principles. Okay, and then the recent advances when it comes to chemotherapy, we have targeted therapy coming up, though it is not a universal thing. Yeah, definitely it is reducing chances of side effect and long term side effect, but at the cost, it comes at a cost. So over the time, hopefully that will become more reasonable and more cost friendly to the
I was
patient, and we are
coming to that
moving in
point
that line.
because so how affordable are these surgeries? Because again, if you are tier 3, tier 4 cities of India where you don't have doctors to consult, so I mean expensive it is, and with the new advancements of technology, would it be I mean affordable for the common man?
See, when it comes to the cost, there are like nowadays it is not that people see now with so many government schemes, there is some options of treatment available at some. So yeah, of course, not everyone may be able to take all this luxurious treatment. But yeah, like Aishman Bharat or ESI scheme largely covers so many populations. So that is one part. And then when it comes to, for example, let us say laparoscopy or robotic surgery versus the open surgery. That is, ultimately it is going to decrease the hospital stay by 2 or 3 days. Other than that, it doesn't give a clear cut advantage in terms of survival. So that extra cost need not be spent on just for that 2 to 3 days of extra hospital stay. So anyway, in the periphery, the hospital stays are cheaper. It's only about the finding a good, reasonable doctor and I mean scientific doctor to. For example, it may they may be in tier 4 places. It may be difficult to find a oncosurgeon. They may have to shift to tier 3 or 2 places for further treatment.
So thank you so much, Dr. Karthik, for joining us today. We at Medicircle are in a mission to increase the healthcare literacy. We all know that whenever we hear the word cancer, there's a scare, and it's really difficult. But most of the time, we are hearing stories of cancer survivors also. Early it is detected, the more and more chances of it getting removed or cured is great to a great extent. But still, cancer is a leading cause of death worldwide, like accounting for more than 10 million deaths in 2020. That is nearly 1 in 6 deaths was caused due to cancer. And as I mentioned in the beginning, most common cancers being breast cancer, lung cancer, colon, rectum, and prostate cancers. So with the awareness, we definitely can go for health checkup plans where we can get it detected and approach a doctor. Some people still think, Dr. Karthik, that it could be treated on its own or it could go on its own, which is completely myth. And you need a proper treatment and a proper guidance to get over it. So to all those people who are watching this video, get your health checkup, and if there is any such symptom, do try connect with your doctor. And most importantly, believe in yourself. India is really progressing. There are so many new advancements in technology that is reducing the cases of and increasing the number of survivors across India. So definitely it is not that deadly that we used to think some years back. And thanks to Dr. Karthik, people like Dr. Karthik, doctors, they are actually treating cancers and operating also, removing the cancers on affordable costs, especially in the tier 3, tier 4 sectors of India, because again, affordability becomes a huge issue. Chemo also becomes a huge issue. But there are a lot of government plans which are operating in this particular domain and making it more and more affordable. Thank you once again, Dr. Karthik, for joining us at
Thank you, ma'am.
Medicircle and spreading this important information about cancer.